When thinking of a heart attack, most of us imagine someone clutching their chest and collapsing to the ground. However, there is a much more dangerous type of heart attack, the silent heart attack. Unlike typical heart attacks with obvious symptoms, a silent heart attack occurs quietly, without severe pain, and is easily overlooked. Many people have experienced a silent heart attack without even knowing it, until a medical checkup or through incidental findings in cardiovascular imaging tests. What's concerning is that out of the 805,000 heart attacks that occur each year in the U.S., around 170,000 are silent types. Although it doesn't manifest dramatically, this type of heart attack still causes significant damage to the heart and can lead to death if not treated promptly. Therefore, recognizing warning signs is extremely important. Many people often ignore vague symptoms such as unusual fatigue, difficulty sleeping, or pain in the neck and jaw, signs that seem unrelated to heart health. However, these could be early warnings the body is trying to send you. Listen to your body. Don't ignore the small signs. They could save your life. Prolonged fatigue, the silent heart attack symptom. Do you feel constantly tired, even without heavy work? Is your body always in a sluggish state, lacking vitality even though you've slept enough? If so, don't dismiss it. This could be an early sign of a silent heart attack. According to a study by the American Heart Association, 70% of women who had heart attacks reported feeling unusual fatigue for several days or weeks before the event. This happens because when blood vessels are blocked, the heart has to work harder to pump blood throughout the body. This overload can make you feel exhausted, even if you're doing nothing. Unlike regular fatigue caused by lack of sleep or overwork, this type of fatigue persists without a clear cause and doesn't improve with rest. You may find yourself unable to do housework, climb stairs, or even simply get out of bed. Prolonged fatigue can also be accompanied by other symptoms like mild shortness of breath, nausea, insomnia, or shortness of breath with light activity. If you or someone you know is experiencing unusual fatigue over a long period, get checked out early. A heart attack doesn't always come with sharp chest pain. Sometimes it's silent and only manifests through subtle changes like unexplained exhaustion. Listen to your body. Cardiovascular health is not something to take lightly. Pressure or tightness in the chest. The silent heart attack signal. One of the most classic signs of a heart attack is a feeling of pressure or tightness in the chest, especially in the center of the chest. However, in the case of a silent heart attack, this symptom is often less obvious and easily overlooked. Instead of feeling intense pain as we usually imagine, many people only experience mild discomfort, tightness in the chest, or a sensation of something pressing down on the chest, sometimes even just a vague feeling of being choked or uncomfortable. This can be mistaken for indigestion, stress, or muscle soreness. What's more concerning is that this symptom often doesn't last long or disappears after a few minutes, causing the person to dismiss it and not seek medical attention. However, this could be the first sign that blood isn't flowing properly to the heart, and if not addressed in time, it could lead to significant heart damage or even death. If you've ever felt a dull ache, tightness in the chest, or a heavy feeling in the chest with no clear cause, don't ignore it. Listen to your body. Sometimes, a heart attack doesn't come with a loud warning. Cold sweats, without clear reason, a silent heart attack. Warning, sweating excessively without a clear cause, especially when your body isn't physically active or when you're in a cool environment, can be a warning sign of a serious health issue. This is not a normal phenomenon and is often linked to problems when the heart isn't receiving enough oxygen or when the cardiovascular system is troubled. When a heart attack occurs, the body undergoes significant changes. The heart can't pump blood efficiently due to blocked blood vessels, causing blood to not circulate properly. This forces the body to work harder to maintain function, leading to cold sweats even without external factors like high temperatures or physical activity, especially when cold sweats are accompanied by other symptoms like unusual fatigue, shortness of breath, or chest pain. This could be a sign of a silent heart attack. Sweating without a clear reason could be a signal that your body is undergoing significant physical stress. It's crucial not to ignore any signs of this abnormality. If you notice that you're sweating excessively without a clear cause, along with other signs like fatigue, shortness of breath, or chest tightness, seek medical help immediately. These are early warnings that could help you avoid serious health risks. Bloating, nausea, and loss of appetite, a silent heart attack. Sign bloating, nausea, and loss of appetite could be warning signs of a serious heart-related issue, especially when blood isn't being pumped properly to the digestive system. When the heart can't supply enough blood and oxygen to the organs, the digestive system is one of the first areas affected. This can lead to symptoms like feeling full quickly, even though you haven't eaten much, or experiencing unexplained nausea. One of the main causes of this is when the arteries are blocked, causing poor blood circulation that affects organs like the stomach and intestines. Insufficient blood supply to the digestive organs can cause you to feel full quickly, lose your appetite, or even feel bloated despite eating little. These symptoms can easily be overlooked or confused with common digestive problems, but if they persist or are accompanied by other signs like chest pain, fatigue, or shortness of breath, it could be a sign of a silent heart attack. If you experience these symptoms, be cautious and seek medical advice to check your health status. Early identification and treatment can help reduce the risk of serious complications. Dizziness or lightheadedness, a warning sign of a silent heart attack. One of the main causes of this is when the arteries are blocked, causing poor blood circulation that affects organs like the stomach and intestines. Insufficient blood supply to the digestive organs can cause you to feel full quickly, lose your appetite, or even feel bloated despite eating little. These symptoms can easily be overlooked or confused with common digestive problems. But if they persist or are accompanied by other signs like chest pain, fatigue, or shortness of breath, it could be a sign of a silent heart attack. If you experience these symptoms, be cautious and seek medical advice to check your health status. Early identification and treatment can help reduce the risk of serious complications. Dizziness or lightheadedness, a warning sign of a silent heart attack.